As Nigeria battles world's second largest diphtheria outbreak within 10,322 confirmed and 16,616 suspected cases since the beginning of the year, the European Union is taking a significant step towards combating this health crisis by donating £1 million, which is about 847 million naira. Now, this humanitarian funding is earmarked to combat the diphtheria outbreak in Nigeria and assist the most affected communities. This is in addition to £150,000 initially allocated to the Disaster Response Emergency Fund of the International Federation of the Red Cross and Red Crescent Societies in March this year. Now, so far, nearly 600 deaths have been recorded, with Kano State being the worst hit area. Now, this crisis has also affected states like Yobe, Katsina, Borno, Bauchi, and Kaduna State, accounting for 96% of all suspected cases. Diphtheria, a highly contagious bacterial infection, primarily transmitted between humans, targets the upper respiratory tract, leading to severe breathing difficulties and even suffocation. The most vulnerable groups are children and those lacking full vaccination against the disease. Alarmingly, children aged 1 to 14 years represent the majority of the 72% of the confirmed cases. Over 60% of these cases reveal individuals who haven't received vaccination, and this highlights the urgency for preventive care. Of course, the EU's aid aims to bolster UNICEF and the Alliance for International Medical Action efforts by providing technical expertise, staff support, enhanced surveillance, treatment provision, and community awareness campaigns. This substantial funding is part of the EU's epidemics tool designed for swift intervention during disease outbreaks. Of course, to discuss this further, I'm being joined at the moment by News Central's Health Desk Lead, Dr. Kelechi Okoro. Thank you so much for your time, Kelechi.
Thank you so much for having me.
Now, considering the severity of this particular outbreak, which of course specific areas do you believe should take priority?
Okay, so of course, apart from the monitoring and disease surveillance, apart from treatment, diagnosis, and prevention, apart from medical expertise, technical support, staffing, I would say that the key priority should go to, vaccination and extensive and engaging or strategic community engagement. For the vaccination, we can see from the statistics that 60% of the suspected cases are those who have not received any vaccination, and also the children. So I would say that if efforts are put towards vaccinating, then we can reduce, diseases and also reduce the spread. Of course, if more people are vaccinated, they will not be able to catch the disease and the spread will not continue. Despite all the efforts, the disease has gradually spread from the northwest to the northeast, and one of the reasons why this is happening is because of poor vaccination. And also talking about community engagement, strategic and extensive community engagement, this would help more people to know about the disease and also curb the spread. Yes, so that's where I believe that more focus should be. Yes, enough efforts, more efforts on the obvious monitoring and surveillance, diagnosis, picking up the diseases and all of that. But please, let's focus on vaccination, preventing further spread, and education.
All right, and now, of course, I would like to stay with you on vaccination. What do you think are the obstacles hindering vaccination efforts in these particular areas that are affected?
Okay, yeah, so we know that the areas that are affected are basically, the northern areas and also the people who are displaced. And one of the things that I would say that, reduces vaccination uptake is education. I say that I keep talking about education, and also poor infrastructure, poor health infrastructure, poor access to this vaccination. Even the availability of the vaccinations is also a problem. I would also say vaccine hesitancy, not just for the diphtheria vaccine, for many other diseases that are vaccine preventable, vaccine hesitation, where people are not even willing to take these vaccinations because, hey, what am I taking this vaccination for? The symptoms for diphtheria are like flu, are like malaria, and so people are like, oh, it's just the regular malaria, so why do I need to take a vaccination for something I'm not even suffering from yet? So poor education, cultural and religious sentiments, and just the hesitancy that comes with having vaccinations. We saw that in the times of coronavirus, where people had a lot of conspiracy theories and they felt like vaccination wasn't for them and they didn't need it. So that's one of the reasons why there's poor uptake when it comes to vaccination.
Now, the statistics actually highlight that children aged from 1 to 14 years constitute the majority of the confirmed cases, sadly. Now, can you elaborate on the chances or challenges faced by these vulnerable groups during this particular outbreak?
Okay, children, especially children below 5, they don't have the kind of immunity that adults have. So, poor immunity makes them more susceptible to infections and diseases like this. And also, lack of vaccination still boils down to the areas that do not even have enough vaccination. In for children, there's the DPT vaccination that covers for diphtheria, polio, and tetanus. And there are a lot of children who haven't even have had this vaccine for the first time. And then also incomplete vaccination. Some people start these vaccinations and they do not even complete it, some children. And also children have guidance. They are more, they depend on caregivers. And if the caregivers don't even have enough information or have poor seeking health behaviors, then how do we guarantee that the children are going to even get the care that they need? So when the caregivers are not properly informed or have low health seeking behaviors, it will also affect the children. And also children play a lot. They have more, contact with adults or more contact with themselves. So it's easy to pass this disease from person to person, from child to child, from adult to child, and, like that. Okay. So, yes.
I mean, before I let you go, now we talked about, of course, funding. Now, let's assume that these funds are deployed strategically and judiciously. What level of impact are we projecting from these kinds of donation? Okay,
so assuming, like you said, that these funds are deployed strategically and judiciously, we would be seeing, less spread of the disease. We would see an arrest of the disease, hopefully. We would see better health infrastructure. We would see better vaccination, more access to vaccination. We would see, we will see, hopefully, more lives being saved. We would see a sustainable community engagement, sustainable vaccine uptake, sustainable, diagnosis and treatment. Hopefully, if these funds are deployed strategically. And also, apart from all of this I've talked about, we know that all this cannot happen if there's poor medical staffing, there is poor technical support and staffing support. So hopefully, if all of these monies are deployed judiciously and effectively, all of this would happen. And we can say bye-bye and bye-bye forever to diphtheria. Yes, it's a preventable illness, so hopefully it shouldn't be, yes, at this time.
All right. Thank you so much for your time, Dr. Kelechi Okoro. Thank you once again.
Thank you so much for having me. And remember that your health and your happiness is our concern here.